Sure. Okay, now I'm reading what you're saying. Sure, bone development and so on. I didn't even explain. I didn't even explain this part. So you're sure following the part of the syllabus because the development and the part of the embryology you're covering as portion of the histology. So as a result, to cover the same things twice, we're not doing that, and as a result, you will cover that later in the semester as a part of the embryology. Okay. So yes, you need to follow the part of the syllabus. Okay, I do believe we can start already. And again, what I was saying was that, as you remember, when we were talking about the muscles of the back, I told you one important thing. I told you that although the muscles of the back are literally localized there, but according to their function, not all of them are representing the movement of the back itself, so particularly of the vertebral column. Do you remember? And as a result, we were even subdividing the muscles of the back, for example, into the extrinsic and intrinsic layers, or extrinsic and intrinsic back muscles, where only intrinsic were considered as the muscles of the back proper, so which were mainly moving the vertebral column. So as a result, the question is, what about the extrinsic muscles? Yes. And here comes the idea that extrinsic muscles are mainly composing the axio-appendicular muscles, because according to their attachments, the part of the proximal attachment will be always on the axial skeleton, and their distal attachment most commonly will be on the appendicular skeleton. That's why sorry, starting with the muscles of the upper limb, here comes the part of the pectoral or shoulder girdle, as well as the portion of the scapular regions. And what are the muscles here? That's why at the very beginning, in the case of the upper limb, we need to speak about the muscles which the screen is stuck for everyone, or is it stuck for everyone or not, guys? Okay, no, it's working. Um, okay, so what do we have here is particularly, this is the part of the axio-appendicular muscles, particularly the anterior axio-appendicular muscles, as they are mainly attaching, on the case of the axial skeleton, they are attaching to the anterior part of it. So what do we have in the case of the anterior axial skeleton? Here you can see that we're talking about the part of the thorax, the portion of the particularly the part of the ribs, as well as at the sternum. So as a result, you will see that out of 4 muscles of the anterior axio-appendicular region, you will have mainly all of them attached either to the ribs or to the sternum, or both of them. So you could see particularly here, as always we have the part of the table where the different types of the muscles are designated. And as you can see, normally we do have 4 types or 4 muscles in the case of the anterior axio-appendicular region. And these are, as you can see particularly here, we do have a part of the pectoralis major muscle. That's how it looks like. This is the pectoralis major muscle. Here you can see underneath it, so under the part of a pectoralis major, you can see a cut of a pectoralis major on both of the sides. We do have a structure which we call pectoralis minor. Here we do have a very small muscle which we call the subclavius, and the last one but not least, which you see on the picture D, this is the serratus anterior muscle. So let's go through every and each of them, and let's talk what are they and what are they comprising. So in the case of the portion of the pectoralis major muscle. That's what you can see particularly here. That's what we most commonly call pecs, or muscles literally, although they look like the muscles of the chest, because do you remember when we're talking about the thorax, we also saw that yes, we have the chest muscles, for example, the same pectoralis muscles, but in the according to their function, they are mainly playing a role in the movement of the upper limb rather than the movement of the thorax itself. Because in the case of the thoracic muscles, as you remember, we had particularly the ones which are moving the portion, the region of the ribs, so the costal region, rather than the part of the upper limb. So as a result, what do we see here is that this is the pectoralis major muscle, which contains two main heads. So one head, according to its shore proximal attachment. So in the case of the one head, which you see here, that's what we call the clavicular head. And the second one, as you can see, according to its attachment, this is the sternocostal type of the head. They also identify that we do have some abdominal part, although this is just because the inferior most tendinous part of the pectoralis major is simply blending into the tendons of the abdominal muscles. So that's what we'll see when we'll cover the portion of the abdominal muscles there. So as a result, what do we see in this case is that particularly in the clavicular head, we do have the attachment to the clavicle, particularly its middle half on the anterior surface of the clavicle. And in the case of the part of the sternocostal head, as you can see here, from the name, I do believe it's clear that we are talking about the part of the sternum, so attachment to the sternum, to the portions of the costal cartilages, and particularly of the superior 6 or 7 ribs on both of the sides. As a result, as the part of attachment is so broad, you can see that these two heads can be doing the different types of the functions even, and we will see that. So, but on the other side, where you do have part of a distal attachment, do you remember when I was explaining the bones of the upper limb, particularly the humerus? I told you that we do have here the part of the lateral most greater tubercle, as well as more anteriorly medially localized lesser tubercle. In between of them, we said that we do have intertubercular sulcus or intertubercular groove or bicipital groove, whatever you will call it. All of these names are and titles are for the same structure. So this particular groove means that we do have the invagination there, yes? So in this invagination, so means that it will have the sides, so medial side on here and the lateral side, yes? So particularly for the pectoralis major muscle as this axial appendicular. So axial skeleton, okay, the attachment here is understandable. But what about the appendicular skeleton attachment? And here you can see that particularly the lateral side or border, or also known as lip of the intertubercular sulcus or groove of the humerus will be the one for the attachment of the pectoralis major muscle. So as you can see here, the pectoralis major muscle is a very broad one. It's like a little bit fan-shaped, as you can see here. And according to that, you can understand what type of the movement can be performed in case of the contraction of that muscle, yes? So here comes that. Imagine that this muscle, as you can see here, contracting simultaneously with both of the heads, okay? So what could be here the expected type of the movement? Plus, you see what particular joint it is crossing. The most important joint here, which it is crossing, this is the part of the shoulder joint or glenohumeral joint. What type of joint is that? As you remember, this is particularly the ball and socket type of joint, yes? As a result, it is the multi-axial type of the joint, so the movement here can be various. So we can have flexion, extension, abduction, adduction, circumduction, yes, as you remember, and even rotation. So as a result, imagine that all of these fibers are contracting. So where they will pull the part of the humerus here. So I do believe it's clear that they will pull it towards the midline, towards the median plane, and that type of the movement, simply we call it the adduction. So as a result, one of the important type of the movement here will be the adduction. But we should not forget the type of the joint which it is crossing. And we said that in this case, the glenohumeral joint can make also the rotatory type of movement, yes? So as a result, if the humerus is pulled towards the midline, it can be also producing the rotatory type of movement, particularly the internal type of the rotation or medial type of the rotation of the humerus. Is this part understandable why it is like that? Till now? Good. Let's continue. And as you remember, the glenohumeral joint itself means that we have it between the humerus and the scapula. Am I right? So as a result, and you remember that the scapula also has only one attachment, bone-to-bone attachment, to the clavicle, and through the clavicle is attached to the axial skeleton. As a result, the movement of the scapula is much easier, and because of the pectoralis major, it's a large muscle, and by its contraction, sure, during the movement of the adduction as well as some medial rotation of the humerus, we will also have the movement of the scapula. Where it can be moving, it's the anterior axioappendicular muscle, yes? Sure, it will be moving towards the costal surface and the part of the ribs, and as a result, it can give us the part of the anterior and some inferior type of the movement of the scapula. So you see this large muscle, because first of all of its structure, its shape, and its attachment, can simply do not only move the part of the humerus where it is literally attached to, but also the part of the scapula. Now the question is, if we do have, okay, two heads, then it means that we may have there the part of the movement or particular action when we have alone the contraction of the clavicular head or the part of the sternocostal head here, yes? And as a result, the interesting thing here is that when we have the clavicular head, I do believe it's clear that only this part of the muscle, when it starts to contract, it will be pulling the part of the humerus more anteriorly, and as a result can help us in the flexion of the humerus, as you can see here. So as a result, the clavicular head, if it acts alone, can contribute in the flexion of the humerus. In the case of the sternocostal head, that's what you can see particularly here, it is more inferiorly localized, as you see. And as a result, interesting thing that from the flexed position, okay, when, for example, we do have the clavicular head, which was contracting, from the flexed position, the part of the sternocostal head can be extending the humerus. As a result, what we need to remember that this muscle either produces adduction as well as the medial rotation of the humerus, additionally, indirectly moving the part of the scapula anteriorly and drawing it a little bit inferiorly, as well as we do have the action of the clavicular head, which gives us some flexion, and from this flexed position with more inferior part of a muscle, which is represented by the sternocostal head, can produce the extension. So that's what I want you to remember about the pectoralis major muscle. If we'll compare the other muscles here, what we have out of these four, two are really large muscles. So the set one was the pectoralis major, and one is, as you can see particularly here, this is our part of the serratus anterior. If you remember, I explained the meaning of the word serratus, Latin word serratus, particularly in the case of the muscles of the thorax. Yes, because you remember that's where we had the serratus posterior, superior, and serratus posterior inferior muscles. So the serratus literally means saw-like structure. So as a result, it's very well seen in the in case of the serratus anterior muscle, representing the anterior axial-appendicular ones. So here, the question is that what are the attachments of this particular muscle? As a result, as you can see here, although it is identified in your textbook that most commonly proximal attachment is from the third to the ninth rib, particularly on its more lateral regions, sometimes it also can be, in some variations, also can be attached to the second rib or second pair of rib, correctly to say, on both of the sides. And a distal attachment is even more interesting. Why? Because, as you can see, it is surrounding the wall of the thorax and passing or turning posteriorly towards the scapula. And the most interesting thing, that it is attaching to the medial border of the scapula. Can you imagine? So meaning that although it's not seen very well here, but let's see, it's simply, oops, sorry. So here we do have a part of serratus anterior muscle, just to see how it is attached and understand the attachment. That's what I want to show you mainly. Just a second, please. Okay, maybe here it will be better seen. So you see, so it is surrounding and the thoracic wall and passing under the portion of the clavicle, under the portion of the scapula, and attaches the scapula medial border. So not the lateral one, not the outside one, no, particularly to the medial border. That's what is also seen here. So literally the part of the medial border of the scapula is mainly the place for the attachment. According to that picture, you can also see that the part of, or which surface is there. Okay, medial border has the two surfaces, the anterior one and posterior one. Yes, as this muscle is passing under the scapula, as a result, it is mainly attached to, distally attached to the anterior surface of the medial border of the scapula. So that's how it looks like. The next portion, what we see here is that what could be the action of that muscle? It's also a large muscle, as well as the pectoralis major, and as a result, it will be producing the movement of the shoulder girdle. But how and where? Sure, directly acting on the scapula. And in this case, imagine that these muscle, all of these fibers are contracting, and what they will be doing, they will be pulling the part of the scapula towards the ribs, yes? As a result, this movement simply, that's what we call, if you remember, when we've covered the introductory portion, we said about the protraction and retraction of the scapula. It was the special type of a movement. In the case of the protraction of the scapula, the movement was literally anterior and lateral. In case of a retraction of the scapula, the movement was mainly directed posteriorly and medially. As a result, in this case, the serratus anterior muscle will give us the protraction of the scapula, as well as it will help to hold the scapula against the part of the thoracic wall, so stabilize it also, because you remember that there is no bone-to-bone attachment of the scapula to the actual skeleton directly. So, and also it has, because you see it is pulling the scapula, let's like that, not just from the costal surface, but particularly from the medial border. Yes, from the anterior surface of the medial border. This means that we can have here the rotation of a scapula. Let me show you what I mean. And here you can see the very nice picture, which we'll also go through. You can see the different movements of the scapula. So as a result, we have elevation and depression, as you see here in the discontinuous linings, as well as we do have a part of the rotation, you see? So as a result, you can see here that in the part of this table where we have a summary of the movements of the scapula, as you can see here, that a protraction, you see, is mainly dependent, because in the bold they show you the major type of muscle which is participating in that action. And here you can see that we do have the serratus anterior, which we've talked right now about, yes, as well as in some upward rotation. As you can see, the serratus anterior is helping us. Why? Because serratus anterior is not just attached to one point. As you have seen, it is attached to the approximately the whole border on the anterior surface of it, okay? As a result, the inferior part of the serratus anterior will be rotating our scapula, as you can see in this red discontinuous line, literally upward, okay? So how can we memorize all of this information? To be honest, just simply to think logically what these muscles can do, okay? In both in case of the pectoralis and in case of the serratus anterior, according to their attachment, it is already clear what should we expect as their action. What was interesting is that although we had 4 muscles, yes, here I skipped 2 and continued to talk about the part of serratus anterior. So why I did this? Because the other 2 muscles are much smaller. As you can see here, we do have a part of the pectoralis minor, as well as the subclavius is even smaller, as you can see particularly here. And in the case of the pectoralis minor, you can see that it is mainly attached to the anterior surface and superior surface of the 3rd, 4th, and 5th ribs. Sometimes can be the 2nd rib also here playing the role by its proximal attachment, but in the case of its distal one, as you can see, it is attached to the part of the coracoid process of the scapula, as you can see here. This coracoid process, although it's small, we still can subdivide the surfaces there, and as a result, we always say that in this case we are talking about mainly the medial border, as well as we do have some part of the superior surface, as you can see, of the coracoid process for the attachment of the pectoralis minor. So again, coming back, why I skipped it and why I explain it right now, because these type of the muscles, which are smaller, most commonly they will either just assist in the movement, or like assistant in not only by contracting and performing particular movement, but also by them stabilizing particular structures. In this case, we do have literally the stabilization of the scapula, as you can see it here. How? Imagine this muscle is contracting, yes? Again, we will have this pulling of the scapula towards the anterior, in the anterior direction. And as a result, it helps us to stabilize it against the part of the thoracic wall. So that's why the same happens for the part of the subclavius, although in this case the movement is not connected to the scapula. But why? From the name itself, subclavius. And you remember when we were talking about the clavicle there, we said that we do have the on the inferior surface the attachment for the muscle which we call the subclavius. Yes, so simply this is the muscle itself, and as you can see here, mainly it is attached at the junction of the first costal cartilage and the first rib, as you can see. And according to its distal attachment, it is very much associated, sure, with the clavicle, particularly its inferior surface, but it doesn't cover the whole inferior surface. As you can see, it's a small muscle, and mainly we say that middle part of the clavicle, middle third part, that's like that, of the clavicle, is the one where we have the attachment of the subclavius. Now imagine this muscle, which is literally a very short one, and as a result, and really very small, as a result, the contraction of that muscle will not produce particular type of the movement. Yes, it will mainly again help in the stabilization of the clavicular structure. So in this case, it will be helping in anchoring, let's like that, the clavicle in the horizontal position and depressing it to its horizontal position. So if you remember, when we're talking about the joints, we said about, for example, sternoclavicular joint, we said that it's really very very strong type of the joint, but still it was only associated with a part of the sternal end of the clavicle. And here you can see that the part of the middle region of the clavicle is also having additional stabilization with the help of the subclavius muscle. So as a result, when we said about the muscles of the extraappendicular region, yes, particularly the anterior ones, please remember that we do have 4 of them. This is pectoralis major and minor. By the way, in the case of pectoralis minor, it will be interesting for us to see, because when we'll cover the part of the blood supply in the next semesters, you will see that the part of the pectoralis minor is used for the demarcation, like for example, here we do have a part of the axillary artery which passes posterior to it, and this axillary artery gives rise to the blood supply of the axilla itself, as well as the part of the scapula and the muscles which are surrounding the scapula, which we'll talk also today about. So that's how it looks like. Here we do have the nice picture E, which is designating in the reddish color what are the proximal attachments, or simply origins of these muscles, as well as where we can see here the part of the, in the bluish color, we can see the attachment which is distal, or simply the insertion of the muscle. Till now, was it clear or not? Okay, so when we continue, here what I want to show you, this is the part of the axilla and how the different structures are passing through it, because you should not imagine that there is only the muscles and that's all, yes, and some connective tissue, sure not. Here, particularly in the case of the upper limb, we need to remember, so here, by the way, this is the part of the axillary artery. That's what you can see in this case, as well as we do have the axillary vein. Do you see it? This is the part of the axillary vein. As well as in the yellowish color, you can see the structure which we mainly call the brachial plexus and its terminal branches, which we'll study in the case of the next semester in Body Systems 2, where you will see what particular muscles are innervated by the brachial plexus, okay? Because the brachial plexus contains the contains all of the terminal branches for the innervation of the arm, forearm, as well as the part of the manus, so the hand, as well as, sorry, gives rise to the, not the terminal branches, but itself the plexus, so its network of this fibers, let's like that, is giving us the innervation to the axio-appendicular muscles, okay? So next portion, what do we see particularly here? This is the part of the posterior axio-appendicular muscles. So the ones which were represented as the extrinsic back muscles, the ones which are although are seen in the portion of the back, but they are not moving the vertebral column, as we know. So here you can see that normally you can see that we mainly subdivided into the superficial and the intermediate groups. Do you remember we've talked about that when we're talking about the muscles of the back, that extrinsic muscles can be subdivided into two main parts, yes? So it was the part of the superficial and the intermediate group of the extrinsic back muscles. All of them together are comprising the posterior axio-appendicular muscles. So what is interesting in this case is that in the case of these muscles, we can make the subdivision according to their attachment and the function. So you can see that we do have the superficial posterior axio-appendicular muscles, and mainly here we do have only two types of muscles, which you can see here. These are the part of the trapezius. As you can see here, this is trapezius, as well as the part of the latissimus dorsi here, or on the second side, which is better seen in this region. Do you see? This is the part of the latissimus dorsi muscle. The part of the deep posterior axio-appendicular muscles, here they are really very small type of the muscles. This is, as you can see here, the part of the levator scapula, this type of muscle, as well as we do have the portion of the rhomboids here, and the rhomboids are also representing the true axio-appendicular muscles, okay? I mean posterior one. And also, as you can see here, we identify the muscles of the scapulohumeral region. Look, they are not that much attached to the axial skeleton in reality, but they are mainly attached to the part of the scapula, or for example the acromion of the scapula, maybe even some part of the clavicle. You will see that in the case of a deltoid. And on the other side, I mean, their insertion is mainly localized on the humerus. So as a result, here we do have much larger amount of the muscles. First of all, we have four type of muscles here, which we call rotator cuff muscles. That's what you can see particularly. Yeah. Here they are. This is the lateral view of the scapula, and you can see that from all of the sides. We do have these four muscles. This is particularly, you can see the supraspinatus. The names are also very easy to remember. I will explain them later today, but still, just to tell you, if you remember the surfaces of the scapula, according to that, out of four, three muscles have the same name. So in the case, if you remember, on the posterior surface of the scapula, we had the spine of the scapula, which was dividing the whole surface into two parts. Yes, we had the supraspinous fossa and the infraspinous fossa. As a result, the muscles which are attached here, these are the supraspinatus and the part of the infraspinatus muscle, which is very well seen here. And again, the part of the supraspinatus and the infraspinatus muscle, okay? From the other side, from the anterior side, or costal surface, correctly to say, you remember we named this particular fossa the subscapular fossa, and particularly here, sure, we'll have the muscle which we call subscapularis muscle, which is seen also very well in the anterior view. As you can see here, this is the part of the subscapularis muscle. And additionally here, on the part of the lateral edge or lateral border of the scapula, we also have the teres minor, as you can see. As a result, supraspinatus, infraspinatus, teres minor, as well as the subscapularis. They are the ones which are surrounding the part of the scapula, and as you can see by their insertions, that's what you can see particularly here, are associated with the humerus, particularly with the greater and the lesser tubercles of the humerus. So as a result, that's why we call them rotator cuff muscles. So like a cuff, they are surrounding the part of the scapula as well as the glenohumeral joint, and mainly sure assisting in the rotation. Although not all of them, and I will show you that why and where do we have what particular muscles. So coming back here, as a result, what I want you to remember, what are the subdivisions of that muscles and what types of muscles are represented here. This is the one thing. So let's continue now and let's talk about every and each of the muscle here, and starting with a part of the trapezius. You can see that trapezius is really a large muscle, so it is really very broad type of the muscle, and as a result you can see that we can even subdivide it into three main parts. So we do have ascending part because its fibers of that muscle are literally oriented, as you can see, obliquely and superiorly towards the spine of the scapula, as well as we do have the middle part of the trapezius, where we have horizontally oriented type of the fibers, and we do have the descending part of the trapezius, which is mainly associated with the direction of the fibers. Again, as you can see, descending from the part even of the occipital bone of the head, as well cranium, as well as the cervical region of the vertebrae, going down towards the part of the spine of the scapula, and not only the spine, because here you can see that particularly its distal attachment is very much associated with the spine of the scapula, the acromial part, and even the lateral 1/3 of the clavicle. So do you see? So it's like making a small turn anteriorly, so from the posterior side goes anteriorly and makes like a small turn here. So now the question is, what are the attachments in the case of the proximal region? Yes, so the attachments here is particularly the part of the sure, the spinous processes of the vertebrae, but again, starting from the very first one, as you can see here, you remember that when we're talking about the spinous process as for the attachment, most commonly we are the attachment comes from the C7 and down goes inferiorly towards the thoracic vertebrae. As you can see, most commonly even extends for the trapezius, it extends towards the part of the T12 vertebra, its spinous process. In the case of superior most part, which you can see here, this is mainly associated with the nuchal ligament, as you remember again from the back region, as well as you can see that we do have a part of the superior nuchal line, which is localized at the occipital bone. As a result, all of this structure, all of these attachments, sorry, are representing the proximal attachment of that muscle. Yes, and as they are descending or horizontally moving, or it will be ascending type of the part, sure, they will have particular movements. Yes, so as a result, if we will see back again in this table, we can see again either it will be the elevation or depression, or it will be the protraction and retraction, or it will be the downward or upward rotation of the scapula. Yes, so what is interesting here for us is that because the trapezius muscle is much larger, it's is having the even different parts there. You can see that if we talk about the, for example, descending part, so the one which is descending from the nuchal ligament, sorry, nuchal line, as nuchal ligament, as well as the part of the nuchal line from the occipital bone, yes, towards the spine of the scapula, as well as its acromion. You can see that contraction of that region of that particular part of the muscle will produce simply, it will draw the scapula up. Yes, so literally we'll pull it superiorly, and as a result, we will have the elevation of the scapula. Although in the elevation of the scapula, we even have the other type of the muscle, which is from the name even clear, will be the will be performing that function. You can see here, this is the second muscle, which we call levator scapula, which is also representing the axio-appendicular muscles, by the way. So again and again, the trapezius muscle with the descending portion of it will be giving us the elevation of the scapula, and that's what you can see particularly here. So elevation of the scapula, which is mainly seen in the reddish discontinuous line. Now the next question is, if I do have the part of the middle region or part of the trapezius, what will be what type of the movement will be produced here? Yes, again, we have literally 6 movements in this case. Either it will be elevation, or it will be depression, or it will be retraction, protraction, or upward or downward rotation. Yes, so as a result, if it's the middle one, imagine that it comes from the midline, it comes from the, I mean, the fibers are passing from the spinous processes of the vertebral column and attaching to the part of the spine of the scapula. So they will be pulling during the contraction. Mainly, they will be pulling the whole scapula where posteriorly and medially. Yes. Sorry. What type of the movement is that? And here comes particularly the retraction, as we remember. And the retraction is simply the posterior and the medial movement of the scapula. That's what you can see particularly here in the greenish color. This is the part of the retraction of the scapula. As well as now you will say that, okay, but we have also the descending type of the, ascending part of the trapezius muscle. So what it will do, imagine that it is attached again, and imagine that it is contracting. So what type of the muscular movement you can expect here? And one of the important things, what is it will be contributing to, but not that much, this will be the part of the depression. Yes, why depression? If the descending one, okay, which was attached more superiorly, we're pulling the part of the scapula up, so that's why we had elevation. In the case of the part of the ascending, which is ascending from the lower thoracic vertebrae, their spinous processes, sure, it will be drawing the part of the scapula down. So as a result, that's what we call the depression. Although an interesting thing in the depression of the scapula, you can see that, sure, first of all, in any type of the on any type of the object, we always have the gravity force, yes, which is affecting it and which is always having the tendency to pull it down, so depress it. Although the part of a trapezius muscle, as you can see here, its ascending part will be taking part in that movement. Now, so as a result, the part of the trapezius muscle, this large muscle, again and again, it is extrinsic back muscle, but literally it's the superficial posterior axio-appendicular muscle, and as a result, the movement it has, its action it has on the scapula, but not the vertebral column. Till now, was it clear or not? Good. The next part, what do we have here, is particularly the part of the latissimus dorsi, because we said that in the superficial posterior axio-appendicular muscles, we have also latissimus dorsi. To be honest, it's, if you ask me, it's really one of the most beautiful muscles here. And attachment is also very interesting because according to its proximal attachment, as you can see, it is really very broad. You see, starting approximately somewhere at the middle of the vertebral column on its spinous processes particularly, yes, you can see that like approximately T8, although sometimes T7 also. It goes down, going through the part of the thoracic as well as the lumbar portions, as well as it is associated even with the part of the hip bone, particularly the structure which we call iliac crest. And you already remember the iliac crest because we have we have explained it in the case of the erector spinae muscle, as you remember, yes, the part of erector spinae muscle, particularly iliocostalis. That's why we call it like that, because it also was attached to the portion of the iliac crest, even the posterior surface of the sacrum. So these everything gives rise to the proximal attachment of the latissimus dorsi. But the most interesting part of latissimus dorsi it is the distal attachment. You see that although it is very broad proximally, distally, you see that the muscle passes inferiorly to the part of the axilla, as you can see here from the anterior view, passes out from the medial side of the humerus and anteriorly starts to attach to the part of the, again, the part of the intertubercular sulcus of the humerus. So that's the most interesting part here, to be honest. And why? Because imagine, although it's the posterior axio-appendicular muscle, by its passage and the distal attachment, it is still comes to more medial and more anterior surface of the humerus. Now imagine this muscle is contracting. This large muscle is contracting. I do believe it's clear that it will be pulling the portion of the humerus where posteriorly. Yes, this is the first thing. And as a result, here sure we will have the part of the extension first of all. Although correctly to say, the part of the latissimus dorsi is most commonly used in the climbing movements, you know. So when we are trying to catch a particular structure, for example, on a ladder or whatever it is, more superior structures, then the whole body should be moving towards the upper limbs. Yeah, so during the climbing, and particularly in this case, the part of latissimus dorsi helps us to perform this movement. It's very difficult movement, okay, and as a result, we do have this large muscle which helps us to do that. So what is interesting here, like a part of the scapula, as you can see in this particular table, the part of the scapula, although there is no direct attachment, as for example for the trapezius muscle, yes, that's why mainly the latissimus dorsi will perform not only, but mainly will be performing the part of the downward rotation. Because imagine that we are, extending the part of the humerus, yes, and as a result, the humerus is attached to the part of the scapula in this case. So where it should be going, I mean itself, the part of the scapula, it should be making the rotation in this case, and as a result, in this case, it will be the downward rotation. What does it mean, downward rotation, for us? This is important when the glenoid cavity, as you can, this is the part of glenoid cavity, yes? So when the glenoid cavity is rotating down, okay, so laterally and down, and as a result, most commonly, it will be dependent on the part of the latissimus dorsi, as you can see. Although you understand that anything what is making the movement of the scapula mainly posteriorly, mainly medially, this everything sure will be also giving us the retraction, although not the main retractor of the scapula is the latissimus dorsi, because it doesn't have direct attachment here, but indirectly it still assists to the part of the trapezius muscle here, as well as it gives some depression, as you can see, which is also, it's not a main depressor, as most none of the muscles are, but still it's not a main depressor, but it's also helping or assisting in that particular type of movement. Okay. So as a result, when we see here the part, oh, sorry, not here, here. Yeah. So here, particularly when we see the part of the latissimus dorsi and trapezius muscle, we need to know their attachment, the action, as well as how they are classified. So that they are either, we can classify them as the extrinsic muscles, yes, of the back, or simply the superficial posterior axial appendicular muscles. Um, Okay, I would like to have some rest, all right, for 10 minutes. Now on my watch, it is 13:56. So directly in 10 minutes, I will be back, all right? And we will continue with the muscles of the axial-appendicular region and the portion of the dear Hamda, I need to drink the tea for my throat. So in 10 minutes, I will be here. And first, we will do your question, okay? All right, thank you so much, and I will be back in 10 minutes.